Imagine a child that has no known allergies to just have their face all of a sudden swell up like a balloon and you have no idea why or what to do about the situation. This was the situation that me and my family had experienced about 2 years ago when my son had an allergic reaction to peanuts. The morning started out and my son was sitting and eating a generic brand box of Cheerios, and I noticed that he had a little hive on his neck. I didn't think too much of it, and I gave him some Benadryl and decided that I would go about my business and run some errands. I ran down to the post office, and my husband and his friend stayed behind to watch the kids. Within 5 minutes, my husband's friend was trying to find me because my son's face had swelled up like a balloon character that you see on cartoons. We rushed him to the ER only to find out that he had an allergic reaction to peanuts. As the ER doctors were going through possible things that he could have eaten and asking me to go back through the list, there was not peanuts on this list once. I went back through, and that morning all he had eaten was some generic Cheerios. After they treated him at the hospital, we came home and I read on the box only to find out that this cereal had an allergy warning that say that it may contain peanuts or had been processed in the same plant to where peanuts had been processed in. The cereal had been contaminated at one point or the other, and this is the situation that my family was in when we found out that my son had a serious allergy to peanuts and had an anaphylactic condition. I'm going to explain to you today what anaphylaxis is, where these allergies are coming from, and what we can do to be prepared to help others in having an allergic reaction with anaphylaxis. Anaphylaxis can occur within a few minutes to being exposed to a certain allergen. Some of the most serious cases are usually food allergens, stinging or biting insects. Medications can also cause an allergic reaction, as to where if you have an allergy to latex, you can have an anaphylactic reaction. That doesn't necessarily mean that those are the only things can actually contribute to an anaphylactic reaction. The symptoms of anaphylaxis may include hives, itching, flushing of the skin, swelling of your lips, tongue, mouth, and can sometimes include vomiting. But these symptoms are not limited to this. There can also be convulsions, seizures, and worst case scenario, it can result in death within minutes. The airway is often affected when you're having an anaphylactic reaction. This will result in tightness of the throat, chest, and difficulty breathing. Reactions can be accompanied with chest pain, low blood pressure, dizziness, and headaches. More than 1 million children today in America are affected from a peanut allergy alone. According to records, virtually nobody had a peanut allergy prior to the 1900s, despite the fact that peanuts have always been around and children have always eaten them and been exposed to peanuts. So that offers the question, why so many children today are having allergic reactions to peanuts and tree nuts when they didn't have them years ago? There's one doctor who has written in his book, The Doctor Within, Dr. Tim O'Shea, thinks that the reason for so many allergic reactions today are due to vaccinations. This is strictly a theory. Nobody knows the true cause of why so many children are having allergic reactions to peanuts and tree nuts today. He says that vaccinations are largely responsible for both evident and increased prevalence of a peanut allergy. Nothing that many vaccines and even antibiotics contain or were being made or used in the 1900s. They have decided that they use expients potentially derived from peanut oil to put in vaccinations since the 1960s. Since it is since peanut oil is relatively inexpensive, the oil is used to preserve these vaccinations at a cheap cost. They began to put the peanut oil in the vaccines in the 1960s, according to some reports. And peanut-derived expiants are still believed to be used today. But peanut oil's specific role in triggering the peanut allergy epidemic was not seen today and is fully not understood. Even though the introduction at the turn of the 20th century appears to have caused a sudden and very apparent wave of anaphylaxis, which had never been seen before. Anaphylaxis, of course, is a general term used to denote allergic reactions to foods or other triggers. The peanut oil was used in the vaccine and drug production, it turns out, and the more the population began to suffer from the serious food allergies, the more they realized that this peanut oil had been in these vaccines. Utilizing peanut oil combined with other drugs was a great way for the drug industries, of course, as it works as an effective preservative, as I said before. But those who ingest or are injected with it, or peanut oil-based enhancing agents, can become the preceptor of a very serious and permanent peanut allergy. Dr. O'Shea says, specifically, although peanut allergies became fairly common during the 1980s, it wasn't until the early 1990s to where there was a sudden surge of children with reactions to peanuts. The true epidemic appeared then. And as vaccines doubled between the 1980s and the 1990s, thousands of kids were beginning to exhibit peanut sensitivities, which many had violent reactions that were sometimes fatal. So what can we do to prevent these peanut allergies? Obviously, I don't believe in not vaccinating your children. I still give my son vaccinations, and there's no proof that this peanut oil is actually in these vaccines because they don't label it on there. They say there's such a minute amount that it's not really there. They don't have to record it. So, in other words, the best thing that we can do as the public is to be trained and prepared on what to do if you was to come across someone who has who is having an anaphylactic attack with an allergy. First, there's no cure for a peanut allergy, and no therapies to eliminate the severity of the peanut allergy. Current treatments only address the symptoms of an allergic reaction once it has taken place. According to the National Institute of Allergy and Infectious Diseases, the only way to prevent an allergic reaction is to completely avoid exposure to whatever you are allergic to. That's the only way. There's nothing else you can do. I personally believe, after learning with my son, it's the best policy for anybody who's offering a child food to ask their parents if they have an allergy to anything. It could be milk, soy, wheat, not necessarily just peanuts, but some of these foods contain it. And just because you don't think it actually has that ingredient in it, because it doesn't actually have a nut in it, does not mean that it has not been mixed in when they've processed it. They can let me give you an example. An example of M&Ms. They say they may contain peanuts, and that is plain M&Ms. There's many of the candy bars and stuff. So one way to learn is just good to always ask the parent if the child has an allergy to something. Once a person that has an allergy has been exposed and you realize they are having an anaphylactic attack, the best thing to do is to remain calm. Find an EpiPen. If they are anaphylactic, most people carry an EpiPen with them everywhere they go. If they have an EpiPen, remove the blue cap, then stick it in their thigh, hold it for 10 seconds to inject the medicine, and release and call 911 immediately. The EpiPen is not a fix. It temporarily helps them adjusting their heart rate and stops the swelling so that you have time to get them to a hospital. Maximum 15 minutes. It is a rush. Meet the ambulance. Do not mess around with it. I believe that everybody should be trained in this first aid because, as I said earlier, peanut allergies are becoming more and more prevalent. And that's just the peanut allergies. That's not the allergies to the insects, the milk, the wheat, the soy, the fish, for many other examples. Anaphylaxis is a serious condition that doctors aren't certain why is becoming so overwhelming. They don't know why so many people, so many children are becoming anaphylactic to foods that were never there before. So the best things we can do, learn about it, know what to do if you were to come across someone who is having an anaphylactic attack, and just be smart. Don't give anybody or any child any food that you think may contain or harm them. As I said before, there is no treatment for it. The best thing is no exposure. Thank you.